kick us off now, everyone.
Okay, great.
Hello again, and welcome to our webinar on the Caregiver Insights Study, a groundbreaking new study that demonstrates the strong positive benefits of personalized virtual support for family caregivers, who, as you all know, are more isolated than ever amid the COVID-19 pandemic. With millions of Americans now serving as caregivers in the US today, this is an issue that is more important than ever. In this webinar, we're going to discuss the findings of the Caregiver Insight Study and why they are so meaningful, especially against the backdrop of the pandemic. We'll also talk about what healthcare stakeholders can do to apply these learnings in the real world. And we'll leave some time for audience questions at the end, so please be sure to include yours in the chat box at any time during our conversation today. So without further ado, I'd like to introduce our esteemed panelists. Joining us today is John Shaw, the CEO of Caregiver Action Network, the nation's leading family caregiver organization. CAN works to improve the quality of life for more than 90 million Americans who care for loved ones with chronic conditions, disabilities, disease, or the frailties of old age. CAN also provided the caregivers who participated in the Insight study. Also with us is Hillary Ebach, the co-founder and CEO of Carallel, whose caregiver support solution was tested in this study. Carallel was founded in 2017 to help ensure that no caregiver has to walk the caregiving journey alone. Carallel blends comprehensive web-based tools with compassionate, on-demand guidance from a team of expert care advocates to help reduce caregiver stress and improve confidence for everyone who tuned in for today's discussion. So let's start the stage for today's conversation by letting each of you share a brief story about why this topic is so important to you. Let's start with you, John.
Okay, thank you, Patty. I guess one of the reasons this is so important to me is because the Insight study was really looking at what caregivers need now in the moment. I'll tell you from my personal experience, that's just hugely important. I remember my mother had a stroke from being the caregiver for my dad. She was the primary caregiver for him. My dad is 13 years older. And I'll tell you, when I got the call that my mother had a stroke, you could have knocked me over with a feather. If you were telling me that my 93-year-old father, who was suffering from all these chronic conditions, had a stroke, that would have made sense. But I was being told that my perfectly healthy 80-year-old mother was the one having the stroke. And that's really from the stress of the family caregiving role. So that to me is why it's so important. And you know, we have known that family caregivers need direct supports to reduce that stress level. Certainly we've been trying for years to provide that. But really, we haven't had enough real-world research evidence to show how those direct supports help those family caregivers and reduce that stress. So that's one of the reasons I think this is just so important what we're talking about today.
Thank you for sharing that with us. Hillary, how about you?
Patty, my story is also about being a caregiver. My co-founder and brother, John Vanta, and I shared the experience of caring for our elderly parents. In the case of our father, we had a medical crisis. He had a massive stroke and passed away a couple of months later. And in the case of my mother, we walked with her down a long, slow path into dementia. And my experience was that while caregiving was tremendously fulfilling, provided a sense of purpose, was most definitely a labor of love. If I'm honest, it was also really, really challenging, really hard, at times confusing, painful, stressful. And I found that when I was going through that experience, being able to talk to someone who actually understood what caregiving is all about was just tremendously reassuring, and I think helped me be more effective through the ups and downs of the journey.
I think that we can all really relate to both of your stories, which is unfortunate, but these stories are not at all uncommon. John, can you tell us more about what it's like to be a caregiver? Tell us about who maybe are the nation's caregivers and what's that role typically like?
Sure, and these are very common stories. With family caregivers, what we've discovered is they feel two things right off the bat. They feel overwhelmed and they feel isolated. And you'll find this in almost every family caregiver situation. It's interesting because family caregivers themselves now really span the spectrum of everybody in the population. Um, it's not just women who are family caregivers anymore. Men are now almost as likely to self-identify as family caregivers as women. And very interestingly, many more young people and millennials as family caregivers. And that's simply because the demand for family caregiving has increased so much. Overwhelmed and isolated. I guess it's no surprise that they're overwhelmed when you think of the family caregivers really acting as the care manager for their loved one's care. And care manager means they're thinking about every aspect of it, from managing the medications to thinking about the finances to trying to get answers to all those extremely difficult insurance questions, handling transportation back and forth to medical appointments. It is an overwhelming role. Isolation, too, that even though tens of millions of us are in the same situation, when it's happening to you, you feel alone. The interesting thing about both feeling overwhelmed and isolated is that it does put huge stress on that family caregiver, and family caregivers themselves, simply because of the stress of their role, are much more likely to suffer depression, hypertension, diabetes, stroke, simply from the stress of being a family caregiver. So that's what we've seen really as the common denominators across the country.
Yeah. And you mentioned self-identifying. It seems like more and more people are self-identifying as caregivers. Can you shed a little light on how the pandemic has increased the number of caregivers and impacted their experience?
Well, there's no question the COVID-19 pandemic has made everything just even more challenging. And the numbers bear this out. Obviously, more people to care for because of the effect of the pandemic, but actually in very concrete ways. There are numbers from CDC study showing that depression and anxiety in the population up generally, as you can imagine, because of COVID, and among caregivers in particular. Now that's problematic because family caregivers already suffered much more rates of depression than non-family caregivers. In fact, about twice as much. Indeed, if you're a wife caring for your husband, you're 6 times more likely to suffer depression. So it already had high levels of depression and anxiety. And then you add on the COVID pandemic effect on top of that, according to the CDC numbers, and it's really quite tough. In very concrete ways, COVID has made the family caregiving experience more challenging. I'll just very briefly talk about a couple of those. The in-person supports that a lot of people, family caregivers, depend on, so they feel less isolated, just simply aren't as available in the pandemic because we're just not spending as much time with each other in person. The financial aspects, too, become much more challenging. Caregiving has always been expensive. There are a lot of out-of-pocket expenses for things that you pay for that Medicare doesn't cover, insurance doesn't cover. And now you put on top of that the economic situation that you may be unemployed because of the pandemic. The financial situation becomes awfully, awfully, awfully tough. And then thirdly, COVID pandemic has really affected and really changed family caregiving when it comes to making the decision about caring for your elderly loved ones and whether you keep them at home. Everybody wants to age at home, right? Nobody has said, oh, please put me in a nursing home. That's never been the case. But especially now, when we see nursing homes really suffering from COVID-19 cases, it really becomes even more difficult for a family to want to place their elderly loved ones in some assisted living facility. So keeping it at home is great, except keeping them home longer certainly involves challenges, making sure they're away from the children who may be carrying COVID, trying to keep everybody happy, juggling all those and under one roof. So there's just no question that COVID has made family caregiving, generally speaking, much more challenging, much more difficult during these months.
That all makes a lot of sense. I think we could use a little hope added to this conversation now. So let's turn our attention to the Insight study. It was conducted from April to July of 2020 at the height of the first wave of the pandemic. And given this backdrop, Hillary, why did Carallel conduct this study? Like, what were you hoping to find out? Did you have a hypothesis that you entered with?
We conducted the study as part of GuideWell Innovation's Caring for Caregivers Health Innovation Challenge. And as many of you probably know, GuideWell Innovation is part of a family of companies doing really innovative and transformative things in healthcare. So we were chosen as a finalist in the Innovation Challenge, and GuideWell funded the study. So by way of background, Carallel provides caregiver support in the form of digital tools, as well as on-demand one-on-one support from real-life caregiving experts, which we call care advocates. And our care advocates, by the way, also staff the Family Caregiver Help Desk for Caregiver Action Network. So in this study, we wanted to focus on the care advocates and measure the impact of ongoing support on things like caregivers' stress, burnout, feelings of isolation, general well-being, and confidence in caring for their loved ones. And we already knew from the thousands of interactions we have with caregivers that building that trusting relationship with a care advocate helps caregivers feel overall better and more confidence in their ability to care for their loved ones. So what we wanted to do with this study was look at how a formal program on behalf of a payer might generate the same outcomes. We felt that this was a really important thing to study even before the pandemic. In fact, planning for the study started long before the pandemic. As the ranks of caregivers have increased, as John mentioned, with the pandemic, as the challenges of caregiving have intensified, it makes the study results just all the more relevant.
Absolutely. You raise a really important point that it hasn't created this problem, it has exacerbated this problem.
Right.
Can you take us through the design of the study? It sounds very interesting.
Sure. So as a first step, Caregiver Action Network helped us recruit the study participants. So thank you to them for that. And we then paired the caregivers with care advocates who facilitated weekly outbound calls over the study period from April to July of this year. And then in addition to those scheduled calls, caregivers could reach out to the care advocates at any time during the study period through any mode of communication, be it phone, live chat, or email. And then the caregivers provided, the care advocates provided caregivers with active coaching, education, resources, crisis management throughout the study period. The approach was really to meet caregivers where they were, providing both general caregiving support as well as individual tailored support, unique to each caregiver's situation. So during the study period, the care advocates made nearly 700 calls with the interaction time on average of about 21 minutes. They answered nearly 1,000 web inquiries and provided more than 400 educational materials in the form of videos and all sorts of other supporting materials covering topics like general caregiving tips, self-care, which is a big one, financial support, support groups, and the like. And then the study results were based on pre and post program surveys completed by the study participants.
That's fantastic. It sounds like more than 50 caregivers completed the study start to finish during a pandemic, no less. Why is that number so significant, John?
Well, I think the number is significant for a couple of reasons. When you think about it, these support services that Carallel was providing were over a period of time. So when you think of 90 days, or in some cases 120 days, and the caregivers who are participating stuck with it, that says a lot. I will tell you, family caregiving is something that's very, very challenging in real time, and you never know what's going to come up. And the fact that that many caregivers, as part of the study, were continuing to rely on these support services for 90 days and beyond is itself significant. I think the number is also significant because, as we know, there are almost as many different family caregiving situations as there are family caregivers. So you always want to be able to demonstrate with enough family caregivers so that you really can be confident that the data you're getting is going to be reliable. Because certainly people's challenges differ. Where they are in the family caregiving journey happens to be different. I would say many of the challenges are similar, but you're not all facing them at the same time or in the same ways. And so that's why it's important to have had a number of caregivers so you get that diversity of what their needs and challenges are. And so you can rely on the data being confident that even in that diversity, you're making a difference.
That's great. That is really important. And speaking of being confident in the data, Hillary, what were the most important findings of the study and why were they so meaningful?
We were thrilled with the results of the study, which convincingly showed the positive impact of caregiver support. So among other things, we saw statistically significant decreases in caregiver stress, feelings of being overwhelmed, and isolation. Conversely, we saw statistically significant increases in caregivers' senses of overall well-being and confidence in their ability to care for their loved ones. 90% of caregiver participants told us that having help at that moment of need reduced their stress, and 87% said that the program helped them make better decisions. So those are big numbers. 90% feeling like when they had the help when they needed, they were less stressed, and they also felt the program just made them more confident in their decisions and made better decisions. Other things we heard from the caregivers was that they had fewer days in crisis mode. They had more days when they felt well and content, and they felt that they had help with their caregiving duties. You asked why these results are meaningful, and I would say first and foremost, caregivers should not have to walk alone. And so the fact that we were able to make a difference in these caregivers' lives was tremendously gratifying and important. Also, as John has mentioned, there's just not a lot of data about caregivers right now. So we feel that this is an important contribution. It adds to what we know anecdotally, but it provides hard data about the importance of supporting caregivers. And then I would say the results are particularly meaningful for health insurers because they show that a program of robust ongoing support is a tool that can actually drive meaningful member satisfaction and build the trust that is critical to having a positive impact on health outcomes and by the way, reduce the cost of the overall cost of care for both caregivers and their loved ones.
All very exciting. John, from your perspective, why is this so significant, and what does it add to the national conversation?
I think what's important here is this study is exactly the type of evidence that the research landscape has always needed. And finally, with this study and some others that are going on, we're finally being able to demonstrate in research ways that these supports make a huge difference. So that in itself is significant. We needed exactly this type of evidence. We've needed it for years, but for lack of funding or for whatever reasons, it just hasn't come together. And now you really see it coming together. So I just cannot underscore enough how important that is. I also want to talk just a little bit about two of the numbers and why they're so impressive to me. You know, when you see numbers of 90% saying it decreased their stress, or 87% saying it increased their confidence in making decisions, I confess I did not ever expect to see numbers that high. You know, these are self-reported. You know, they're not prompted, not encouraging you just to say good things. This is the caregivers really reporting how the support made them feel. I want to go with it for just one more level, though, because it isn't just the feeling that they feel less stressed or more confident. That translates directly into better health outcomes for both the patient and the caregiver and reduced healthcare costs. Remember, it's the stress of the role that's causing twice as much depression, strokes, twice as much high blood pressure. Reducing the stress is not only a good feeling for the family caregivers, it's a huge improvement in their health outcomes and reduced healthcare costs. Same thing with confidence in making healthcare decisions. What's really happened in healthcare in the last few years is more and more care has been pushed to the home. Hospitals discharge us faster. With COVID, oftentimes we're not even going to get into the doctor's office or the hospital. More care is in the home. And so many family caregivers are performing, frankly, pretty sophisticated medical tasks that we normally associate with nurses or doctors. The wound care, IVs. I mean, this is not trivial stuff. The fact that caregivers, after receiving these support services, feel 87% more confident in the care they're providing and the decisions they make. Again, that is a huge impact on healthcare outcomes for the patient and reduce costs. And that's why I just hope everybody in this landscape, from healthcare professionals to professional caregivers, to insurance companies, to others, are really looking at this data, because it's not just a matter of making people feel good, making family caregivers feel better, but that translates into genuinely better health outcomes and reduced costs.
Fantastic. I think to bring some of this data to life, it would be nice to hear from a caregiver who participated in the Insight study. Kathy Jermack has graciously agreed to share her story with us in her own words, so we'll watch that now.
I'm Kathy, and I live in Clearwater, Florida. Well, I guess I participated in the study because I needed some help. I really did. About 2.5 years ago, I had a really bad case of caregiver burnout, I discovered, and I was becoming this person that I didn't like. I was having these meltdowns and issues and things and stress, and I don't know, I saw a change in myself. I didn't like that person, whoever she was. The negative stuff started coming back out, and the COVID hit, and my stress level seemed to increase and got worse again, and I was having the mini meltdowns again. But I sought out help from the Caregiver Action Network, because they were one of my online resources, and I got their newsletter, and they had me take this survey, and my stress level, I believe it was, they were measuring, or I was measuring it and reporting it back. And then they asked me to participate in the study, so I said, sure, why not? Because I needed all the help I could get, and there they were. Well, the experience that I had in this program, in this study, was tremendous. Stephanie, my advocate, she was the best thing about it, but she was so helpful. I don't know, we hit it off right away, and her voice reminded me of an old friend of mine that I hadn't seen for many years, so I felt real comfortable talking to her on the phone right away, and we had lots of laughs and talked, and she was very supportive and had lots of great ideas, and we, I just kept telling her about my day and my situation and what's going on and how I feel and and it was always something, of course, and she was like, well, you're doing a great job, but might I recommend take a look into this and that, and then I started asking her for resources too on certain topics, and as time goes on, I realized that there's other things that I need too. I just didn't realize it, and they were just an endless supply of resources through the Caregiver Action Network and Carallel, and my stuff wasn't going away, but I was laughing again. Positive stuff all around, and I still have many resources for future things that may not even happened yet that I can access. After I remember that she sent me I go to that file in my emails, and there it is. It's there, and I'm so grateful for that, Stephanie, and that program. I felt so connected again. I felt supportive, and it was also positive. And when it's family, it's really hard too. There's a Kathy tug of war always going on, and I just feel more equipped now to deal with them. And I still have stress, but I don't stress out, and we do what we can do. But I feel a certain amount of a huge amount of relief since I have friends in the Caregiver Action Network and endless resources, and so I think I can handle just about anything now. Thank you very much.
Wow, Kathy, thank you for sharing your story with us. That was beautiful. Shout out to Stephanie. She's the care advocate who must just be amazing. So this study officially ended in July, but Carallel has still been actively deployed for caregivers around the country. Hillary, can you tell us more about some of the ways that Carallel is being used in the real world right now?
Sure. So we're working with payers as one of the first caregiver support offerings, deploying as a supplemental benefit for their Medicare Advantage plans, with varying degrees of care advocate support depending upon where each payer is in their overall caregiver support strategy. We also work with employers who offer our caregiver support as an employee benefit because they're increasingly realizing that they need to support caregivers in their workplace. As mentioned, we also serve as the caregiver help desk for Caregiver Action Network. So collectively, these relationships lead to thousands of interactions with caregivers across the country.
Wow, it's particularly interesting to me that health insurers are really starting to embrace their support. Why would you say that's a big priority for them right now? And they must face a lot of barriers. So how can they overcome those?
Right. So as the population ages, there are more Medicare eligible people who are in need of caregiving. So this has captured the attention of health insurers who realize that caregivers have a tremendous impact over the care of their loved ones. And, let's face it, everybody on this phone call knows that it's usually the family or friend caregiver who's making sure mom gets to the doctor's appointment or making sure that dad is taking his meds. So they are in a unique position to impact the health of their loved one and reduce cost of care, improve quality scores. So it's also gotten a lot of attention lately in the Medicare Advantage market because CMS last year expanded supplemental benefits to explicitly cover caregiver support. I would say stepping back more generally, with more Americans being cared for at home due to the pandemic, it's especially important to reach out and engage with those who are caring for them. As John has mentioned, for health insurers, establishing a trusted relationship with caregivers is directly linked to member health. And we sort of see this as a three-step process. First off, payers need to know who the caregivers are. They don't always know who's caring for their members. So we can help them develop that data. Secondly, once they know who the caregivers are, we can help them build that trusted relationship that is absolutely critical. So this study shows that Carallel can be a catalyst to build trust. And then, of course, once you know who the folks are, you've built a trusted relationship, then we can help payers improve caregiver confidence in decision-making and work with them to close gaps in care.
Fantastic. That all makes a ton of sense. I'm going to turn a big question over to John here. What do you feel caregivers need most right now?
You're right, that is a big question. I think what we find, interestingly, what caregivers need most, two things. One, they need someone to talk to, and two, they need some trusted source that will point them in the direction of the resources that they need. When you think about it, much of the stress of family caregiving is kind of psychological issues like feelings of anger, feelings of guilt, none of which you can really express to the person you're caring for. That's not going to be helpful. So family caregivers really need this person to talk to. And we find that regardless of the situation. And then secondly, about being pointed in the right direction, because family caregiving is somehow a little bit like life itself. At some point, you need everything from A to Z, right? This week, you may, how do I manage meds? Next week, it's, what do I do about my own depression? One week, it's, I can't figure out with this insurance company what the heck we're doing. So all those things come into play. And of course, when you have those particular challenges, you don't know what direction to go and find help. And so I think that having that source that can point you in the right direction when you have that particular need is something that just is so significant to family caregivers. It makes it tough, right? Because those of us who are providing the support in the study really have to be prepared in lots of ways to send them with lots of directions to particular resources. But really, those are the two main things: giving them someone to talk to and being able to point them in the right direction for the help they need with that particular challenge at the time.
That makes a lot of sense. It needs to be comprehensive, for sure. What should we be looking out for, John, when it comes to supporting caregivers, both in the near and the long term?
Well, I think we have to look out for a couple of things. As more people become family caregivers because of the demand, we're really going to have to be tracking their health. So I think what we might find is we're having a lot of adverse health outcomes with more new family caregivers because of the stress of the role. That's not good for them. It's not good for the health system. It's not good for costs. It's not good for anything. So we certainly want to be tracking that. I think also, too, we want to be looking at the financial situations for family caregivers. As more and more care has been pushed to the home, so have some costs. And if you think about an average of $10,000 a year out-of-pocket costs for a family caregiver, and median family income in the United States of about $60,000, you can see it's a pretty big bite. So we're going to have to really look at the financial situation and find some effective ways, policy-wise, to help with the financial burden of family caregiving.
Absolutely. Let's turn that over to Hillary. What do you hope to see change for caregivers in 2021 and maybe even over the next few years?
So I'm going to be greedy, Patty, and hope for three things, not just one.
You may.
Okay, thank you. I would love to see caregivers become more visible They have largely been an invisible, unpaid, unrecognized workforce, so we should know who they are, see them. I'd love to have them be more acknowledged, meaning there being a greater recognition of the value of what they do, not just for their nuclear families, but for the healthcare system overall. And then finally, really the end goal is I hope to see caregivers be more empowered, be given the support, the education, the resources they need to be confident caregivers and ultimately impact health outcomes for themselves and for the people that they love.
I think that we all share those 3 wishes. So maybe John will take one, I'll take one, and we'll have extra
Sounds
support.
good.
This was fantastic. I think our timing is spot on. So we do have a few minutes. Lisa Winsdell, who's with CAN, has been monitoring all of your questions. So we'll let her, with her bright shining light, shine some light on the questions. Very thematic.
Well, hello there, and welcome to my very, very sunny kitchen today. So I've got a couple of questions to get us started here, but I want to encourage people, you can go ahead and send your questions in. You can just put them in the chat or through the questions. And I think the first question probably is going to go to you, John. It's a question about how this study relates to CAN's Caregiver Help Desk. And will this study findings change anything about the help desk?
Thank you, Lisa. I think these findings from this study really help us refine what we're doing with the Caregiver Help Desk nationally. So for those who may not be familiar with it, CAN does provide a free Caregiver Help Desk. We have the professionals from Carallel staff it out of Chicago, a lot of the people who actually provided the support services in this particular study. And any family caregiver anywhere in the country can access this for free, either by telephone or live chat or email. And we really have to be prepared to address any number of issues that a family caregiver may come up with. So I think this really says 2 things for us with the help desk. One, that the help desk approach is exactly what family caregivers need, right? Because it does give them that real-time, immediate support, which this study by Carallel so convincingly shows makes that huge difference. So it certainly validates the approach of this exactly what is needed with the help desk. And then secondly, I think helps us refine a little bit by being able to prioritize the types of issues and challenges we see that caregivers bring up. As I said before, at some point it's like everything from A to Z. There are 1,000 things you can think of that a family caregiver may bring up. But I think what we've discovered is they do tend to group around some issues, and there are some issues that are always asked more often than others. And I think that these findings really help us inform that so that we can be prepared right on the spot to give caregivers the direction that they need.
That's great, thank you. Hillary, there are some questions about the study and when or how people can actually see the findings and get some of these numbers.
Sure, so we'd be happy to follow up with some more details about the study. We can email something to study participants afterwards, but be happy to show people the numbers and dig into a little bit more detail. So happy to follow up on that.
Terrific. And then we've got an interesting question. I'm sorry we can't actually ask Kathy, our caregiver in the video, a live question, but I was wondering, Hillary, if you could share with us, what happened to the caregivers next? So the study is over. Is the support just gone from them? What sort of is the follow-up to take care of them?
Sure. So as I think Kathy mentioned in her video, she now has a pretty full toolbox, full of tools, resources that are go-to resources for her. I think she also from Stephanie, learned all sorts of tips and practices that she's incorporated into her daily life that will stay with her, relaxation tips and the like. So things around self-care that will stay with her. And then, of course, she knows she can always pick up the phone or reach out by email or chat to the help desk on an ongoing basis. So Kathy, I hope I've said the right thing. I'm guessing that that's what she would have said if she could answer the question.
Great, thank you. That's all I'm seeing. If anybody else wants to put anything into the chat or as the question or email me, which some of you did, that's all fine. And of course, if you have any questions in follow-up, you all have my email. We will also be in touch with you, giving you some of these numbers in a print format, because we certainly didn't expect you to have to take notes while Hillary was going over those numbers. But it looks like that's all we have on the live questions right now, Patty.
Fantastic. Thank you so much, Lisa. And a huge thank you to John and to Hillary for such an important conversation today. Definitely, if you're responsible for the quality outcomes at a managed care organization, or you're a large employer looking to support caregivers in your workplace, feel free to reach out to Carallel. And thanks to everyone for joining us for this conversation today. We all have a shared goal of supporting caregivers, and we hope that you learned what you've learned today will help you in your efforts to do so. Thank you so much.